Submission number 200.
Eti rangatira me judge, korua ko Deputy Mayor Dudansky, mana ko hira katoa, tina koto, tina koto, tina koto katoa. My name is Rosemary Clement, and I'm the Acting Chief Executive for the Taranaki District Health Board, and I'm here today with a team of DHB representatives to speak about the return of fluoridation to the water supply here in the New Plymouth District. I'd like to introduce my team, who I brought with me, Dr. Andrea Kelsen, who is our Taranaki DHB community dentist, and she's speaking in lieu of Heather Kreutz, who's also joined us in the gallery. Deneille Walden, who's representing Community Dental, Dr. Jonathan Jarman behind me, our Medical Officer of Health, and Pauline Lockett, the Chair of our District Health Board. And we have support, as you can see, in the gallery, including representatives from our dental therapists. We'll be using a mix of speakers and video clips through our presentation, and we're happy to take questions at the end. So, Taranaki DHB, and particularly our clinical team, understands all too well the impact of non-fluoridated water on the people of our community. And we're of the strong view that the future health of our community will suffer without fluoridation in the district's water supplies. Research shows that children in non-fluoridated areas need more dental intervention, more treatments, more fillings and more extractions. And research also shows us that children at 5 years of age with decayed teeth will often suffer poor oral health in their mid-20s. Poor oral health can contribute to other preventable chronic conditions such as heart disease, and we believe that these risks can be reduced by fluoridation. It is also fair, for it benefits everybody and helps to reduce the differences in oral health between the rich and the poor, and it's well documented that an inequitable burden of disease is carried in higher deprivation communities and in children. The benefits of water fluoridation are greatest in communities with socio-economic disadvantage for Maori, Pacific Islanders, as well as children. However, the entire community can benefit from fluoridation of our district's water supply. Central government has given the responsibility of water fluoridation to local councils, and councils also have an obligation under the Health Act, Section 23, to improve, promote and protect the public health within its district. Community water fluoridation is regarded as one of the top 10 public health interventions of all time. This is because community water fluoridation is an extremely effective public health measure. As the gatekeepers of this decision, our hope is that you will work in partnership with Taranaki District Health Board, and in particular our clinical team and public health unit, to make a positive decision for the people, the young people in particular, of New Plymouth District and reintroduce community water fluoridation. We are of the strong view that there is a groundswell of community-wide support for fluoridation of the district's water supplies, and we know this because families ask our dental therapists every day why we don't have fluoride in our water. The Council, I believe, has also received 272 submissions supporting fluoridation in the district's water supplies, compared with just 9 submissions against. This is a very clear and strong message from our community that they want fluoride returned to their water supply. The science is settled. The Gluckman report is a key piece of research, it will be circulated to you soon, undertaken by the Prime Minister's Chief Science Advisor that provides strong and compelling evidence that community water fluoridation is a safe, effective, affordable and fair method for reducing tooth decay for everyone. In fact, 40% less tooth decay on average for children in fluoridated areas, which was shown in the most recent National New Zealand study. Providing hospital surgical services for people with dental decay and avoidable disease is an expensive business. That is why the focus must be on prevention rather than cure. Fluoridation of the district's water supplies will help us to reduce tooth decay. Money presently used for treating people with dental decay could be redirected to other important areas in the health system. The clinical team presenting today, who work at the coalface of dental care, will provide details about the impacts of tooth decay and share their experiences with families and children they see every day. Dental decay is a very unpleasant disease, as most of the people in this room would know. I personally find it very sad when I hear about children needing general anaesthesia to remove their rotten teeth. Therefore, I urge you to think about prevention. Fluoridation will benefit all children as well as our entire community. We are asking you to work in partnership with the Taranaki DHB to reintroduce fluoridation to these water supplies that were previously fluoridated and extend fluoridation to other community water supplies. So we're just going to show you a short video of the Children's Commissioner, Dr. Russell Wills, speaking on fluoridation. Kia ora.
Just so you know, we've got screens at the front. We're not ignoring what's behind.
All right. I'm pleased you're not ignoring us.
So fluoridation is the single most cost-effective way we have of improving oral health outcomes for children. It makes the biggest difference to our poorest and most vulnerable children. What fluoride does is it works mostly on the flat surfaces of teeth, the fronts that we see. Having missing, filled or holed teeth, particularly in the front, seriously impacts on children's future life chances, in particular their chances of getting a high-paying job. It also impacts on children's respiratory health and cardiac health. So we need to do everything we can, particularly for our poorest and most vulnerable children, to give them the best possible life chances. Fluoridation does that. Most public health interventions involve a choice of rights. Often that's between our right to choose or personal freedom versus a public good. So examples of that include having chlorine added to our water supply, requiring that children wear cycle helmets or use booster seats in cars. And we all accept that these are public health goods and advantage our children, and so we accept those. Fluoride in our water supply is like that. We have a right to choose what's in our water, but children also have the right to the best possible health, and as a country we have a responsibility to do the most that we can to improve their health outcomes and to reduce inequalities. Fluoride is the single most cost-effective way we have of reducing those inequalities for children's oral health. In my view, the small cost of not being able to choose what's in our water is worth the large benefit to those children. You might see some debate about the science of fluoride. In fact, the science is settled. The World Health Organization, the US Centers for Disease Control, the New Zealand Medical Association, dental associations all around the world are all in universal agreement. The benefits of fluoride outweigh any tiny risks. There is no debate in scientific circles about the merits of fluoride. Anti-fluoridationists will tell you that there are risks to fluoride. They'll cite fluoride as being a poison, for example. Any substance in excess is harmful. Sugar, oxygen, water are all dangerous in excess. In fluoridated water supplies, the concentration is 0.7 parts per million. That is enough to protect our teeth. It's not enough to do any harm to any part of our body. The science is quite clear. At that concentration, fluoride benefits our health and it doesn't do harm.
Good afternoon, councillors. My name is Andrea Kelsen and I'm a dental surgeon and specialist in the dental treatment of medically compromised and special needs individuals. I submitted to the long-term plan and I'm speaking it in Heather Croot's submission today. I have been working now as a dentist full-time for 15 years, the last 10 of which have been at Taranaki's District Health Board in its clinics in New Plymouth and Hawera. The job entails a wide range of tasks, including routine restorations, extractions, trauma, on-call, paediatrics, as well as provision of inpatient and general anaesthetic services. I speak today in support of Taranaki District Health Board, my professional dental colleagues, and in support of water fluoridation. Fluoridation is currently practiced in over 30 countries around the world and is endorsed by the World Health Organization. It has been shown to reduce the burden of dental disease, its prevalence within the population, as well as the severity of disease in those individuals affected. It provides benefits above and beyond that of toothbrushing alone. It has proven benefits at all stages of life, from infancy through to adulthood. Thank you. And has over 50 years of epidemiological studies that support its safety and efficacy. Removal or withholding of fluoride from community water supply adversely puts some groups within our community at greater risk of dental and oral health related diseases than others, namely those of lower socio-economic status, the Māori and Pacific Island populations, medically, physically and intellectually compromised individuals, and our elders living within care facilities and rest homes. The follow-on effect from this is that people with poor oral health are at increased risk of cardiovascular disease, diabetes, stroke, and birth of preterm low birth weight babies. Poor oral health leads to poor general health. The mouth is the gateway to the body, and the state of a person's dentition is nearly always a good indicator of their overall health status. I am first and foremost a clinician, and the vast majority of my job involves the physical and mechanical removal of teeth or tooth tissue while treating the advanced effects of dental disease. The individuals I treat are referred to the hospital because they cannot access external
Order, Your Worship.
Sorry.
Sorry to interrupt.
Sorry.
Councillor Chong needs to get offline and listen to the submitter.
Thank you. Councillors, I remind you of what I set out as an expectation at the beginning of the hearings, and that is that we give our full and 100% attention to the people that have given us their time to submit. It is impossible to have your mind and ears on electronic social media whilst these good people are speaking to us.
Social media.
Or any electronic media like that. Please, councillors, and obviously it's you because I hadn't actually said anybody, be mindful of that. Please continue.
Thank you. I'm first and foremost a clinician, and the vast majority of my job involves the physical and mechanical removal of teeth or tooth tissue while treating the advanced effects of dental disease. The individuals I treat are referred to the hospital because they cannot access external dental care or treatment because they are financially compromised, medically or intellectually compromised, elderly, frail, or are children with extensive dental disease who require general anaesthetics for their treatment. A very high number of these individuals have such advanced disease that what they require is extraction of all of their teeth, or what I would call a full dental clearance. And I'd love to tell you that for most parts these individuals are well past middle age, but this is not true. For many of them, they are in their late 20s and early 30s. So despite all the advances in medicine and dentistry over the past century, dental caries and tooth decay still remains the single most chronic disease among New Zealanders of all ages. Every week, I place a number of children on our general anaesthetic list for treatment of infection and decay. These children have multiple abscesses and teeth that require extraction and or crowns. Our general anaesthetic statistics show that these children are most likely to be from low socioeconomic status, Māori and Pacific Island groups. What we need is prevention of disease before it gets to this stage, because the research shows that the more mechanical intervention we do at a young age, the less likely we are to have a compliant patient later on. In 2014, 12 of these children who were placed on the GA list were 2 years of age or younger. And in 2015, up until the 31st of May, we already have 8 children under the age of 2 who have been referred for dental treatment of extensive dental disease under general anaesthetic. We need prevention of the decay before it negatively affects these individuals for their lifetime. Otherwise, we end up with patients failing to present until the situation is in dire need of medical intervention once the infection is well established. These patients are then more likely to experience greater pain, anxiety, need for pharmacological intervention, time away from school or work, inability to eat, or interrupted sleep. A recent example of this is a patient who presented with many of the symptoms above. A simple extraction ended in her having a severe faint, losing consciousness and needing assistance and monitoring from A&E. And this is a costly ending to a simple preventable disease process. It has been shown that getting enough fluoride in childhood would determine the strength of our teeth over their entire lifetime. The process of tooth mineralisation begins in utero, while the developing teeth prior to eruption are beginning to calcify. Low levels of ingested fluoride act systemically by incorporating into the developing teeth in the baby prior to birth. Fluoride, when incorporated into tooth enamel, forms a structure known as fluoroapatite, which is stronger than regular enamel, known as hydroxyapatite. The long-term, low-dose ingestion of fluoride allows for teeth to be protected topically at the tooth surface by assisting with remineralisation, systemically as a buffer against plaque acids when resecreted in the saliva, and there's also evidence to suggest that fluoride is also mildly antibacterial. So census shows us that New Zealand has an ageing population, and if we are living longer, then we need our teeth for longer. Our older population have teeth which have experienced high dental intervention and high amalgam use, and these dental restorations require ongoing maintenance. The elderly, due to diseases of advancing age, may have reduced mobility and loss of manual dexterity, making it difficult for them to maintain their own natural dentitions. Changes in their living circumstances, loss of independence and limited finances mean they may also have difficulty accessing dental care. For this age group, the consumption of fluoridated water can have an important preventative action against formation of root and recurrent caries and the pain and infection that may follow. Dental caries and toothache are responsible for significant reductions in the quality of life of those that it affects. Loss of teeth early in life due to dental decay, pain and infection cause changes in our eating habits, leading to consumption of generally poorer quality foods, which have in turn significant long-term effects on our health and our dentitions. And as I said earlier, poor oral health has been linked to diabetes, cardiovascular disease and stroke, with increased morbidity and mortality associated with these diseases. Many of you counsellors will be heading towards this stage in your life over the next decade or two. Many of you will have been lucky enough to have benefited from the previous years of water fluoridation in New Plymouth. Your predecessors felt the health and well-being of the community as a whole, especially those less fortunate, was worth investing in. It is just one way you can act to reduce the burden of ill health caused by dental disease, but also closing the gap in health inequalities seen in today's communities. I'd like to thank you for your time, and now I'd like to invite my colleague Deneille to speak. Thank you.
Tēnā koutou katoa. Your Worship, the Mayor, Deputy Mayor, Councillors, ladies and gentlemen. My name is Deneille Walden. I'm a registered dental therapist and an oral health educator for the Taranaki District Health Board. I'm speaking to you in the support of reintroduction of community water fluoridation to the New Plymouth District Council district area. I have worked in this region since I graduated in 1984. I speak from many years' experience and from the heart. I am here to advocate for the children of New Plymouth, Waitara and Uranui. They depend on me and my colleagues here today, health professionals acting on their behalf. A large part of my role is to promote oral health to communities. I work alongside Plunket, early childhood centres, including Kohanga Reo, Kura, mainstream schools, health providers and public health nurses to educate local families, local people and whānau around ensuring that they have the best oral health possible. Dental disease is the single most common chronic disease affecting our children, and it's totally preventable. I know from experience that children in low-income families are more likely to consume more sugary drinks and snacks and are less likely to brush their teeth. I see children daily in our area who do not own a toothbrush or share one with another family member. In my clinics, I regularly deal with families struggling with day-to-day issues, parents with their own dental problems, let alone having to support their own children through hours of dental treatment that can often be very invasive and uncomfortable. It is too simplistic to think that if you give these children a lesson in toothbrushing and provide them with a toothbrush and fluoride toothpaste, that this would make a difference. Research, in fact, tells us that classroom lessons have not only failed to produce long-term change behaviour, they often increase inequalities of oral health. While education of families is important for providing good oral health, children from low socioeconomic groups are less likely to respond. These children and families need a fighting chance of healthy teeth, and our adults a better chance of keeping their own teeth for life. Studies show that water fluoridation provides benefits above and beyond those of toothbrushing. Community water fluoridation is not a replacement. The two work hand in hand. Community water fluoridation protects teeth. It doesn't rely on people remembering to take fluoride tablets. It benefits people of all ages. People get protection without having to spend money or change their daily routine. Dental therapists can apply a topical fluoride varnish to our patients' teeth, but often the children that would benefit the most from this extra care do not keep these preventative appointments. Fluoride helps children smile, eat, learn and grow into adults with dignity and confidence, without the pain and the shame. Good oral health is more than just having good teeth and a nice smile, but the value of a smile cannot be understated, as for some it is not that easy. Dental disease and decay is too common. The sad thing is, it is preventable, and the pain, suffering and cost it incurs so unnecessary. Who misses out when fluoride in our water is low? It's our babies, our tamariki, our children. It's our whānau. We would like the New Plymouth District Council to top up the level of fluoride in our water to make the teeth of our whānau healthier. Better teeth, better smiles, more confident people, more chance of employment, more employment, less poverty, less tooth decay, better health. Healthy teeth mean better overall health and well-being for everyone, especially our children. When district councils choose to fluoridate water in their area, they are providing better all-round health for their communities. Why should the people of New Plymouth, Waitara and Uranui be denied the right to better oral health? You can make a positive difference. Have the courage to take positive action on behalf of the whānau of our area. Many factors go into healthy teeth, including diet, fluoride, toothbrushing, flossing, and of course, professional dental care. With the added protection of fluoride in the water supply, we are providing a fence at the top of the cliff, rather than an ambulance at the bottom. I have been a part of many of the tribunals held here in Taranaki, but it is here in New Plymouth that the dental therapists are often questioned as to why the council would take fluoride out of our water supply. These same families would not have the courage to submit to the council, so this is another reason I am here, advocating for these families, speaking on behalf of my colleagues. Society often makes decisions based on benefits to the community as a whole, like the compulsory wearing of seatbelts or adding iodine to salt. Some people see these decisions as limiting our personal choice, but adopting community water fluoridation benefits everyone with their natural teeth. Our community should have access to this benefit. The option remains for people to install a filter to remove fluoride if they so wish. Proposing that the Community Oral Health Service distribute toothbrushes and toothpaste into the community sounds democratic, and in fact we do just this, but it is not an effective public health strategy. This is the ethical question for you. In a society, you must take into account your duty of care. Reintroduce community water fluoridation for the New Plymouth, Waitara and Uranui communities. The freedom of choice argument is fine for those of us with good oral health. Children in low socioeconomic families do not have choices. You have a choice. They do not. Make a decision based on public good for our children for the future. Research tells us community water fluoridation is the most effective and provides immense benefit with less effort required by the recipient. In the years since fluoride was removed from the water supplies, I have seen more decay, deeper decay, and faster decay. Where once the holes in teeth were the size of a pinhead, now they often cover the whole surface of a tooth. Tooth decay is a worldwide epidemic. Community water fluoridation benefits everyone, particularly the children and the elderly, who are at most risk of tooth decay. Children do not have a choice. Make a positive decision based on the long-term health of our children, a positive decision for the people of the New Plymouth District. Thank you. I'd like to share with you a short video. It's a clip featuring a dental therapist and Dr. Rudy Johnson, a dentist.
Heaps of work to be done. Our preschoolers, from right up till 5-year-olds, right up till the seniors, there's just so much work to be done. So these front ones, you've got a couple of holes on the front teeth here. A lot of the preschoolers we have to refer to hospital because they're so young, we can't treat them in the clinic. Good girl, well done. So we're going to go for a ride in the chair, okay? They're baby teeth that have just come through. They're actually decayed before they even make it into the mouth.
I see kids that live in our rural areas with huge holes in their teeth, lots and lots of decay, especially in their front teeth where it shouldn't be seen at all. What we've found is that fluoride in small quantities can be taken up into your teeth and it makes the surface of your teeth really strong, it toughens them.
It's a normality set every day. Everyone knows someone whose children or adults have missing teeth, have tooth decay, brown teeth in the front, black teeth in the front, missing teeth. It's very common and it shouldn't be.
Your Worship the Mayor, councillors, ladies and gentlemen, tēnā koutou, tēnā koutou, tēnā koutou katoa. My name is Jonathan Jarman. I'm a public health physician and I'm employed by the District Health Board as a Medical Officer of Health. I have been employed in this role both in Taranaki and Northland for 20 years. Part of my role, as you know, is to provide advice to district councils, and I provided advice on, for example, reducing alcohol-related harm and also advice on psychoactive substances. A core part of medicine is something called evidence-based practice, which means that the recommendations that I make to council are based on a review of the evidence. What I'd like to do today is just to provide some background about community water fluoridation. It's interesting to consider how long community water fluoridation has been in place in New Zealand. Hastings has had community water fluoridation for 50 years, for 60 years actually, and 48% of New Zealanders live in communities with community water fluoridation. We have heard about the problems that dental decay can cause, and it's a very unpleasant process for anyone who has had a toothache. And for kids who have repeated problems, it can cause significant time off school. But also there are long-term problems, such as it's unsightly. If you have a lot of teeth missing, it lowers self-esteem. It creates decreased employment opportunities. People with missing teeth have problems eating food, healthy food, and also the dental decay can cause health problems. Tooth decay is an irreversible process. Fluoride is naturally occurring in water. It's a common element. It's the 13th most common element in the world. It's found in all water and soils. And what we're talking about with community water fluoridation is supplementation of pre-existing fluoride levels. Dissolved fluoride in water is natural, tasteless, and it's everywhere. But the problem in New Zealand is that our naturally occurring levels are less than the levels required to provide optimal protection for teeth. And this shows some of the concentrations of naturally occurring fluoride. In New Plymouth, I understand it's less than 0.1 parts per million. And what we're talking about is supplementing and topping up that community water fluoride level up to 0.7 to 1 part per million. It's interesting to reflect that 56 countries in the world have natural fluoride levels at 0.7 parts per million or greater. There has been a strong message from High Court that fluoride is not a medicine. For example, Justice Hanson in 2014 said, "I have concluded that fluoridation of water is not medical treatment for the purpose of Section 11 of the New Zealand Bill of Rights Act." And then later in 2014, Justice Collins said, "I have concluded that hydrofluorosalicylic acid and sodium silicofluoride are not medicines under the Medicines Act 1981 as currently used to fluoridate domestic water supplies in New Zealand." Fluoride is the most cost-effective way to protect dental health. 50 cents per person per year, compared with the cost of a single filling, which is $140. 50 cents per person per year. Think how much a toothbrush costs. So you can see that community water fluoridation is extremely cost effective. It's widely supported. Hundreds of reputable health and dental organisations around the world support community water fluoridation. And here's a list of some of them, including the Ministry of Health and the World Health Organization. But not only do these organisations endorse community water fluoridation, 30 countries around the world currently fluoridate their water supplies, and 370 million people drink fluoridated water every day. Another 50 million people have naturally fluoridated water at or near the optimum level. So if we look at what countries we're talking about the United Kingdom, talking about Ireland, we're talking about Australia. 80% of Australians drink fluoridated water. Talking about Spain and the States, 3/4 of people in the United States drink fluoridated water. Other countries that don't fluoridate their drinking water, such as Germany and Switzerland, they fluoridate salt. And other countries, such as Sweden and Italy, don't need to fluoridate their water because they have naturally fluoridated water. Community water fluoridation is safe. The only side effect of fluoridation at the levels used in New Zealand is minimal fluorosis. And what this is just a barely noticeable cosmetic effect on the teeth. In 2014, the Auckland Council and other councils approached the Prime Minister's Chief Science Advisor, the Royal Society of New Zealand, and the Ministry of Health, and what they wanted was a scientific review of the evidence for and against community water fluoridation. And Sir Peter Gluckman carried out this report, and he concluded communities currently without community water fluoridation can be confident that this is a safe option that is cost-saving and of significant public health benefit, particularly in those communities with high prevalence of dental caries. Another point that we need to stress is that community water fluoridation is fair. It bypasses all those socio-economic barriers that prevents the use of decay-preventing products. So basically, everyone and the children, all children, will be drinking fluoridated water in an area with community water fluoridation. Over half of New Zealand children do not brush their teeth twice a day with a fluoridated toothpaste. So this is the group that's particularly going to benefit from fluoridated water. And the photograph's just showing you some kids with some sweet smiles. So, in summary, community water fluoridation is an evidence-based way to protect the health of children. And we're talking about all of our children. And the Taranaki District Health Board urges the New Plymouth District Council to reintroduce community water fluoridation to those water supplies that were previously fluoridated and to extend community water fluoridation to other community water supplies. Kia ora. And we've got a short video clip of Sir Peter Gluckman.
The discovery that the addition of fluoride to water at low concentrations in regions where natural concentrations of fluoride are low was one of the great public health discoveries of the 20th century. It's still very effective, it's still very important, particularly for vulnerable members of our community. There are no health risks, and it's something that really makes a difference to many people's dental health. Because fluoride, like many other substances in high doses, can be toxic, clearly public health and dental scientists have spent many decades looking carefully at the science of putting fluoride at low levels into water. It is one of the most well-studied questions in public health, and the safety of fluoride at these very low concentrations, which are in fact much lower than in many natural water supplies around the world, is certain. While there are no health risks from fluoride in water, at the very low levels of fluoride we use, there can be some small and slight mottling of the teeth, which is not disfiguring, can barely be seen by dentists under microscopes, and it's certainly not the severe fluorosis that is shown on websites from those who oppose fluoride in water.
Your Worship the Mayor, Deputy Mayor, Councillors, ladies and gentlemen, thank you for allowing us to present to you today. I am not a clinician. However, you have heard from the Taranaki District Health Board clinicians and the Medical Officer of Health today. Some people may say that poor oral health is about what people are eating and drinking. We cannot control what people eat and drink. We can only educate, and we can apply preventative mechanisms where we can. Today you will have heard that community water fluoridation deserves its reputation as one of the best, and I repeat, one of the best public health measures of all time. I urge you to think about prevention and make the positive decision to reintroduce fluoride back into our drinking water. Your vote to reintroduce fluoride into our drinking water is also a vote for improving the oral health of our community, and particularly our children's oral health and well-being. The Long-Term Plan Fluoride Officers Report highlights the inability of officers to make recommendations regarding the risks and efficacy of fluoridation. However, we do not believe that the council officers and you, as councillors, are required to do this because, as you have heard today, the Gluckman report concludes the science is settled. Fluoridation of water supplies is safe. Settled science, safe water. Not only is it safe, but it is one of the best preventative tools that we have to fight tooth decay. Our children and our community deserve the right to have the best oral health outcomes possible. Our children do not vote. You, your worship, the Deputy Mayor and councillors, you are the gatekeepers on this matter. Your vote represents the children of the New Plymouth District. We urge you to think about the oral well-being of our children and our district as a whole. We would love for you to vote to put fluoride back into the district's water as soon as possible. In the interim, we urge you to vote for the recommendation that the officers of the New Plymouth District Council have put before you. In partnership, we can work together to ensure that our community has the opportunity to have the best oral health outcomes possible by both of us supporting prevention, by you voting to put fluoride back into the district's water, and by us providing our community with the best public oral health care that we can with the resources that we have available. Tēnā koutou, tēnā koutou, tēnā koutou katoa, and we will now hand out to you our handout, which also includes a copy of the Gluckman report. Thank you.
Can I ask, is anyone prepared to take any questions of clarification, or are you happy that you've simply made your submission?
We're happy to take, if we've got time, we're happy to take a couple of questions and we'll just refer it to our experts. Is that all right?
Yeah, no, that's great. Because I've got quite a list of councillors that want to ask questions.
Okay.
Starting with Councillor Bezic.
Thank you, Worship. A few questions. Ms. Kelsen, if I could ask who directly, probably is the easiest thing, or whoever could answer this one. You mentioned in 2012 that there was 12 under 2-year-olds, I think it was, that went, and then in 2015 there were 8. What was it in 2011, 2010? What were the numbers before then?
I can't give you those numbers, sorry, because I actually get them from my clinical leader, Dave, who's not here today, and Heather probably has a lot more of those numbers, but yeah, I can only give you the last 2 years, but we are seeing an increase of the under 2s and the decay coming in before they actually, all of their teeth are actually in the mouth, so yeah, sorry.
We can provide those.
Yeah, if you want them, we can provide them later, but I can't give them to you now.
Yeah, I mean, personally, that would be interesting because it's easy to say that you've got to increase, but it'd be nice to know what statistically, since we're talking about facts.
Your Worship, just as a query, Heather may be able to help us on that question. She wasn't one of the speakers that was asked to speak, but if you'd like a greater clarification, she could.
Could I, sorry, thank you. For the sake of time, because I've got a lot of councillors with a lot of questions, that we just leave it, that comes back to you,
okay,
councillor.
Right. I can leave my other questions for other councillors.
Thank you. Deputy Mayor?
I'd like to ask Ms Lockett a question. You stated that we cannot control what people eat and drink, and in the next sentence you told us to add fluoride to our water supply, so you were really instructing us to tell people what to drink. What's the difference?
I don't think we're actually asking or directing people to drink water with fluoride in it. As you're aware, you can get a filter to take fluoride out of the water. You're also very aware of the fact from the presentations today that fluoride actually occurs as a natural substance in water. So every time we travel overseas, we go to Italy, we go to other parts of the world, we are actually drinking fluoride. So we are not actually saying that we are directing you to do this because there are no other choices. Of course there are other choices with people. Thank you.
I'm not allowed to debate, you're lucky.
Councillor Allen? Questions or clarification to remind people?
Thank you for an excellent presentation. Sir Peter Gluckman, as you pointed out, is quite clear that fluoride is good. What is the official government stance on fluoridation?
Of course, I can't talk on behalf of the government, but the Ministry of Health is very much in support of community water fluoridation. If you go to their website, there's extensive material supporting community water fluoridation.
Thanks.
Thank you. Councillor Duynhoven.
Thank you. The doctor who spoke first, I think, I'm sorry I don't have your name, you said that fluoridation was beneficial from infancy to old age, and yet when we were debating the fluoride issue 4 or 5 years ago, one of the issues that was raised was the health of babies and the low body weight of babies compared to the content of fluoride that would be in mother's breast milk if they were drinking fluoridated water. Could you comment on that, please?
Breast milk contains very low levels of fluoride because it's actually not passed through into breast milk. Whereas if you look at the Gluckman report, which you'll get the opportunity to read later on, they'll say that it's actually not found to be toxic or at any level in bottled or non-breastfed formulated sort of milk at a level which is at any significant sort of risk or harm or toxic levels for infants. So no.
Supplementary, Councillor Duynhoven.
The issue was raised about infant formula, and you've just addressed that to a degree, but the argument was that because baby's body weight is so low relative to the amount of fluid that they drink with infant formula, that water which is fluoridated would be harmful to the baby. You're saying that's completely nonsense?
The Gluckman report actually goes back through all the research on it and says that it's not toxic to babies at all, and that it's not toxic to the pregnant mother or,
Delighted to hear it.
Okay.
Thank you.
Thank you. Councillor Pearce.
Thank you, Worship. A question probably for our dental technicians. I've always lived I've always lived rurally, and I reside close to Inglewood. Inglewood has never had fluoride to my knowledge, and of course rural people don't have access to it either. Can you say that when you look in a child's mouth that lives in Inglewood or rurally, that you can tell the difference with their teeth?
I can't actually speak for the children of Inglewood because I haven't actually operated in Inglewood at all. However, I have had experience of working in a non-fluoridated area as opposed to one that was fluoridated, and which is now not. And I did definitely notice a difference in teeth. Teeth were stronger right from the start. They have a different look to them. They appear to have a better start to these teeth. There are things that we can do that are helpful and protective, and that is place fissure protections over teeth and also apply fluoride topically.
Can I have a
supplementary?
Just a comment. A few years, a comment for the question, all right. A few years ago when we were debating this, I always felt there was the opportunity to compare the teeth of Inglewood children compared with Waitara who had fluoride, and I was always disappointed that those figures weren't available.
Yeah. I don't actually collect that data.
Yes. Why isn't that data collected?
It's collected. Socioeconomic status, different in Waitara.
You need to go.
And that's what we're talking about.
Versus English as well. You're not comparing apples with pears, really. You know, they're two different.
Understood.
Sorry, Worship, you actually need to...
We are debating across the floor. That's not appropriate.
Thank you.
Councillors, any further questions of clarification? I would ask Pauline Lockett. I have one from the chair to the chair of the Health Board. If you don't mind, I'd look for an answer. Firstly, are you aware that Local Government New Zealand, to which we are a member of, has actually submitted to the Crown or the government to mandate for the country?
Yes, I am aware of that submission.
Based on that, would you join with us in writing to the Minister of Health to actually support us in asking the Ministry to mandate for the country, given all the evidence is before us?
We are in support of putting fluoride back into the water across New Zealand if we can. The government is very aware of this issue. I am also aware of the fact that the government has responded in saying that it is still a local government issue. That's why we're here today, to talk to you as the local government, and that's why we're saying that you are the gatekeepers. You are the ones at the moment that can make that decision.
So that's a no. You wouldn't support a letter to the...
We support fluoride going back into the water, so that was a yes in terms of supporting fluoride going back into the water.
Thank you very much. No, we'll leave it there, I think. Thank you very much, and thank you for your submissions. Appreciate it. Thank you.
Great to see the district health. Well, they did well.